Core-588, like Core-388, targets gingipains and gingipains that cleave at the lysine residue in proteins. However, it's it's a completely different structure of the active part of the molecule. It has been, we've screened it against other targets, and it is even cleaner than Core-388, which was very clean, which bodes well for things like adverse events or potential drug interactions. And secondly, based on the PK in animals, we project that it should be a little longer lasting and can be a once-a-day drug in humans, which is obviously an advantage in general across different diseases, but particularly in Alzheimer's, a disease of memory where people have trouble remembering to take their medication. Simpler medication regimens are important. That drug is going to be in human clinical trials for the first time this quarter. And then we have a whole platform of other gingipain inhibitors beyond that. We have Core-788, actually the number hasn't been finalized yet, but we have an arginine gingipain inhibitor, which cleaves the gingipains at a different amino acid residue, which could be complementary to the lysine-gingipain inhibitors. That's gone through candidate selection and should be in the clinic next year in human clinical trials. And we have other small molecules behind that. And we have a number of, fortunately, P. gingivalis has been associated with a number of different diseases, including periodontal disease, Alzheimer's, Parkinson's, which we're looking at a study in, but it's been associated with all sorts of other diseases. This has been published on in the literature, oral and esophageal cancers, for example. It's been associated with pancreatic cancer in the pancreas, with non-alcoholic steatohepatitis in the liver, atherosclerosis, and other things. So the way I like to think about it is we have a pipeline of different molecules, and there's a long list of different diseases that have high unmet needs that we can potentially attack.